The brush border epithelium present in our gut, that is brush border enterocytes, and cells present in the PCT, which are involved in absorption or reabsorption of certain nutrients, contain a special protein on their absorbing or luminal end that is known as amino acid transporter molecule. Hartnup disease is a particular condition, a hereditary condition, which occurs due to malfunction or rather dysfunction of neutral amino acid transporters. Now, exactly what happens in this condition? In this condition, this neutral amino acid transporter does not function. So there is no absorption of neutral amino acids. The neutral amino acids do not get absorbed from intestine as well as the P cells of or proximal convoluted tubular cells, and hence there is low level of neutral amino acids in the blood and high level of neutral amino acids in the urine and stool. So a lot of neutral amino acid come in urine and stool. So neutral amino acid in urine, this serves as the diagnostic test for Hartnup's disease. So this is diagnostic. Now exactly how do we remember things about Hartnup disease? So the mnemonic itself is Hartnup. And how is so? H represents hereditary, as we already discussed. It was first found in Hartnup family in Britain, and the disease is autosomal recessive. I believe you have seen whenever there is an enzyme deficiency or a protein deficiency or a protein which is malfunctioning or defective, in all these cases the pattern of inheritance is mostly autosomal recessive. That means the defective allele works as the recessive allele, and the disease only is prominent in people who have homozygous recessive pattern of inheritance. The A also represents amino acid urea, amino acid in urine. Now we are talking about deficiency of neutral amino acids in the blood, particularly tryptophan. So low neutral amino acids in blood. One of the major neutral amino acids is our tryptophan. The T should help you remember that. Now tryptophan, why tryptophan is the major one? Tryptophan as an amino acid is involved in two very important biochemical pathways in our body. Tryptophan leads to, after multiple steps, leads to formation of niacin, which is vitamin B3 basically. This niacin has a lot of important functions in our body, including formation of NAD and NADP. This niacin deficiency, as tryptophan makes niacin, in case of Hartnup's disease, deficiency takes place. Since there's low amount of tryptophan in blood, less amount of tryptophan gets converted to niacin, and there's less amount of niacin in the blood. And the niacin deficiency manifests as what we know as pellagra, which is remembered by a triad of dermatitis. It's a pericervical or around the neck dermatitis, that is Castle's necklace, dermatitis, diarrhea, and dementia. So this is one aspect of the major manifestation of Hartnup disease. Tryptophan also produces serotonin. Whenever you have low levels of tryptophan, you will also have low levels of serotonin in the blood. Low levels of serotonin leads to a lot of neurological complications, including ataxia as well as depression. Now this is the second aspect of Hartnup disease. The T in the Hartnup represents tryptophan as well as it also represents transporter defect of neutral amino acids. N should make you remember niacin levels low, as well as it should also make you remember neutral amino acid deficiency. U does not actually represents anything. It is you who have to remember this mnemonic, right? So U is just YOU, and this P should always make you remember pellagra, which occurs due to niacin deficiency, and a very peculiar aspect of Hartnup disease, which is photosensitive rash. I want to use a separate color for that. It is photosensitive rash. The treatment of this condition is very simple. So the treatment includes protein-rich diet, vitamin supplementation, particularly niacin, and address particularly and supportive management for symptoms. And the last P of Hartnup should make you remember protein-rich diet as a treatment.